Hi, hello, Pookies. Welcome back to another episode of the Blunt News podcast, where we say things we were never meant to say out loud. I am your host, Jan. So grab your water, grab your pen, grab your notebook, and let us lock in. Today, we are talking about medical trauma. So, what is medical trauma? Medical trauma is trauma that comes from any medical experience where someone felt powerless, unheard, violated, unsafe in a healthcare setting. So, medical trauma occurs to many people, right? And occurs in many ways. So, these are some of the ways, some of the things that could lead to medical trauma. Painful procedure without proper explanation or consent. For example, if you're going for an operation and they don't explain to you that this is how it is going to be, it is going to hurt this much, it is going to, like, this is step by step what I am going to do. You see, if they don't explain it to you and then they do something to you that you are not expecting could be done, that could lead to medical trauma. What else? Being restrained or held down, e.g. the way we were being held down as kids ndio tungolewe meno. I still have trauma. Mi sizienda kungolewa meno kwa hospitali. It is very, well, anyway, dismissed symptoms. For example, you go to hospital telling them that this is how I feel and this is how I feel, and then wakwambie, enda home, enda ulale or something. That could lead to medical trauma. Misdiagnosis or delayed diagnosis could lead to medical trauma. For example, uambiwe uko na cancer na kumbe uko na ulcers, you know. That could lead to medical trauma, which could lead to you not wanting to go to hospital ever again because hospitals lie, which, valid. Obstetric or gynecological trauma, that is trauma that occurs once you've gone to an obstetrician or a gynecologist and whatever happened was contrary to what you expected would happen. ICU stays also bring about medical traumas. Chronic illness management, poor illness management. Poor chronic illness management could lead to medical trauma. And medical racism, sexism, homophobia, and fatphobia could lead to medical trauma. So, who are the most affected by medical trauma? I will start with the most common and the most ignored: kids. Kids are very much affected by medical trauma. Women, especially around reproductive health. For example, I don't know if you all saw, but there was a woman, she was pregnant and then she was close to delivery and she was complaining about compressions, and then this nurse was just looking at her. Alikuwa tu amekaa hapo. I feel like after that I will never want to give birth again. I don't know. That is medical trauma. And who else is affected by medical trauma? Black patients. It is what it is. Racism is a big problem affecting the world today. So LGBTQ patients also, because of homophobia and people telling them that you brought this upon yourself because why are you gay? People with chronic pain and people with mental health diagnoses, especially people with mental health diagnoses. If when they're hospitally and you're schizophrenic, a lot of them are even beaten up, which is diabolical behavior, but okay. So why do we care? Jennifer, why do we care about medical trauma? We care because creating awareness facilitates validation of experience. You see, once you talk about it, someone else who has experienced the same thing feels like, oh, kumbe si mimi peke yangu, kumbe I had every right to be mad that this happened to me. it breaks the cycle of neglect. You see, when people stay silent, a lot of medics are not held accountable. And then, now you see, with lack of accountability, means people don't take responsibility for their actions. And when they don't take responsibility for their actions, change does not occur. So we are talking about it because we want change to occur. And change cannot occur if we are not aware that this is happening, if we are not aware that change needs to occur, you know? Yeah. So talking about it breaks the cycle of neglect. It ensures that people are held accountable. You know, people take responsibility. Why do we talk about it? Because of the mental health connection, okay? Unaddressed trauma can lead to PTSD, can lead to avoidance of care, panic attacks, panic disorders, anxiety. Yeah. So like talking about it helps to put people in the loop and helps the people who are affected can seek therapy, you know? And once you seek therapy, you know, mental health issues are solved, you get. And we are talking about it because we would like to bring empowerment. Empowerment to the people who feel powerless, empowerment to the people who feel discriminated against, empowerment to the people who feel like healthcare system has abandoned them. Yeah, we are giving them empowerment. So that is why we care. That is why we are talking about it. Now that we've created awareness, we are aware that there is medical trauma and you could be a victim or you could not. But like, yeah. How do we deal with it? We deal with it by first recognizing and naming it. Okay. You see, putting words to fear reduces power because people are afraid of the unknown. So once you name the unknown, fear reduces, right? So once you name the trauma that you experienced, for example, I started being afraid of needles because as a kid, I used to be held down during nidungwe sindano. You have named it. This is what happened. This is why it happened. Like, this is what I am feeling. This is why I am feeling the way I'm feeling. Yeah? So, yeah. You start by naming it. Naming it inakufanya ujue you need help. Right? Now, seek therapy. I know that still, in as much as we're trying to push for mental health awareness, people still don't take mental health seriously. But you need to seek therapy. Enda therapy. Man, enda therapy. Yeah. Prepare and control your medical encounters. How do you prepare? Do your research. These are the symptoms you're feeling, right? This could be symptoms of this, and this, you know? Yeah, this is what you're supposed to, this is the procedure you're supposed to go under. What does this procedure entail? Ndio ukienda huko and then the medical practitioner is not, you know, hafanyi kenye uliona inafaa ifanywe. Ask. Be like, so I was looking up and nikaona, even ndio kuna kuanga, I have these questions. Ask the questions you prepared beforehand. That helps you to feel like you're in control of the situation. Okay. What else? How else do you heal? By mind and body grounding. Do breathing exercises. Do meditation. You know? Pumua vizuri. Take deep breaths before uingie kwa hiyo ofisi ya daktari. It helps you cope when you're in there. It calms your nerves. And, you know, with calm nerves, you're able to communicate clearly with your medical practitioner. You're able to engage, you know. Yeah. Advocate for yourself. What does advocate for yourself mean? When you're comfortable with this practitioner, for example, last time ulienda and this practitioner was inappropriate with you, feel free to ask for another practitioner. Say, I am here for a medical checkup and I don't want Dr. So-and-so to deal with me. I would like maybe another doctor. You know, yeah, this happened and this is not the procedure that you said you would do to me. Unadungwa sindano na walikwambia wanakupea tembe. Talk, advocate for yourself. Ask them, why are you doing this? Report malpractice and negligence. You see, when you keep quiet about it, again, people are not held accountable. Lack of accountability equals lack of responsibility, which in turn equals lack of change. So, voice it, you know, seek, report malpractice, report negligence. Yeah, make sure those people that ignored you there face the consequences. And finally, say, hata mimi walinifanyia hivyo. Aki hata mimi nilienda hiyo hospitali walikuwa hivyo. You know, it feels nice. Unasikia validated. At least unasikia, oh, kumbe si mimi pekee nimejam. Kwa hivyo I was okay kujam. You know? I was okay to be uncomfortable. Kumbe people get uncomfortable. It is normal. It is okay for me, you know? Hearing the Me Too gives you, it reduces the shame, it reduces the isolation. So yeah, as we conclude, because we are at the end, as we conclude, I'll leave you with a task, yeah? I'll leave you with a task. Research your patient rights in Kenya. Why is this important? Because if the healthcare system is supposed to heal, why do many people live feeling wounded? Right? And what will happen if we demanded change, if we demanded better? And you know, you can't demand better if you don't know what better looks like. Sindo, you know, you can't dream beyond your exposure. So like, if you need to demand better, you need to know what better is. So research your patient rights in Kenya. Find out what should happen to you as a patient in Kenya. Yeah, with that, we have come to the end of our episode. I will see you guys in the next episode. I love you guys so much. Make sure you like, comment, share, subscribe. Bye.